My name is Aria Bartlett, and I will be doing the multi-state outbreak of Salmonella, Tennessee infections linked to peanut butter. Step 1, Background and Statistics. In November of 2006, U.S. public officials noted a rise in infection of Salmonella, Tennessee. So public health officials in multiple states conducted a large-scale investigation of the outbreak of Salmonella serotype Tennessee. There were 715 cases of Salmonella identified within 48 states. The onset of symptoms dates range from August 2006 to July of 2007. And within the beginning of 2007, public health officials began to interview patients who were infected with the strain of Salmonella. Background and statistics continued. Interviews revealed that of those affected, 85% had consumed peanut butter. Epidemiological studies revealed that specifically Peter Pan and Great Value peanut butter had been linked to Salmonella serotype. Both Peter Pan and Great Value peanut butter were made in the same facility in Georgia. As a result of the findings behind this outbreak, the facility in Georgia took precautions to ensure that there would no longer be any infections going forward. The facility was cleaned and sanitized and created a hazard and critical control points plan. They also made it a point to have proper preparation methods when making peanut butter, separating raw ingredients from those already cooked. Consumers were also urged by the FDA to not eat peanut butter from these brands made in this facility. Case analysis. There was an outbreak of Salmonella serotype Tennessee linked to peanut butter that caused a widespread infection in multiple states. Strength is a widespread awareness of the epidemic by public health officials and the utilization of epidemiological studies to find the source of the issue. Weakness is a lack of investigation on the facility in Georgia that was linked to producing products contaminated with Salmonella. Opportunity is to have safer production practices within facilities when making peanut butter and other food products. Threat is to populations who had purchased infected jars prior to the recall and had consumed it unknowingly. Step 3, the core issues. Salmonella is a bacteria that is the main cause of foodborne illness. This virus is also highly contagious, and this virus can cause fever, diarrhea, nausea, and a host of other discomforting symptoms. Although Salmonella will usually go away if it's left untreated, the infection can be very serious in older adults and can lead to some chronic health problems. The core of this issue is that there was a widespread outbreak of Salmonella in multiple states, so many individuals were susceptible to the harmful effects of this virus. Steps 4 and 5, alternative solutions and recommendations. One solution is to have screenings for Salmonella and other viruses among facilities that produce any type of food product prior to shipping it out to be sold within the stores. Another solution would be to require facilities to have monitors over the food, making processes to ensure food susceptible to viruses will not be infected. One recommendation is to implement policies that require stores to monitor the products they put on the shelf. Another recommendation is to immediately remove any type of food product that serves a potential threat to be put off the shelf immediately after conducting epidemiological studies that may lead them to believe that there is a threat. Step 6, action plan. The action plan is starting in the year 2001. Public health officials will implement policies to analyze facilities to ensure that proper preparation techniques are being used. By the year 2006, we will have Salmonella screenings across facilities statewide prior to shipping of any food products. In the year 2008, stores will be required to screen any food products and produces prior to putting it on the shelf. By 2011, Salmonella serotype Tennessee will be eradicated and the disease will no longer be a threat. Step 7, opinion. In my opinion, Salmonella is a very threatening virus. So I pay close attention to news and other data that come out when there's an outbreak in our food products. I make sure I check all of my labels to make sure that there have been no recalls on the products that I am purchasing and I am not putting myself to any danger. Salmonella comes with a host of harmful side effects, so in my opinion, that is very threatening. I am very thorough when I purchase my food products, and I make sure that I see all the labels to make sure that there are no recalls on them.